Welcome to the Explainer. Today, we're breaking down the latest treatment updates for Pemphigus vulgaris. Now, as future dental professionals, this is a rare but absolutely critical condition you might be the very first person to spot right in a patient's mouth. Understanding these treatments isn't just about passing an exam, it's about knowing the incredible journey your patient is about to go on, a journey that could start with you. So let's just start with a question that gets right to the heart of your clinical work. Could you? Because while this sounds like something for a dermatologist, the very first signs of Pemphigus vulgaris often show up orally. That makes your role, your trained eye, totally pivotal. So to really get why the treatments work, we have to understand the disease. Pemphigus vulgaris is basically an autoimmune betrayal. Your body's own defense system starts attacking these proteins called desmoglians. Now, you can think of desmoglians as the molecular glue holding our skin and mucosal cells together. When that glue starts to fail, the cells pull apart, and that's what leads to those awful, painful blisters and erosions. All right, here's our game plan for this explainer. We're going to start with what you'll actually see in the clinic, the oral signs. Then we'll jump into 4 key therapeutic strategies: B-cell depletion, selective targeting, rapid antibody clearance, and oral modulation. And we'll wrap it all up by looking at what this all means for the future of treating PV. Okay, before we get into the nitty-gritty of treatments, let's just really hammer this point home. You are on the front lines here. Seriously. A patient with these weird, painful sores in their mouth is way more likely to see their dentist before they ever think about seeing a dermatologist. And this is what you're looking for. These aren't your everyday canker sores. We're talking about blisters, or bullae, that rupture and leave behind these ragged, incredibly painful, and just persistent erosions anywhere in the mouth. Recognizing that these lesions are something more, something systemic, and making that referral for diagnosis, that action can literally save a person's life. Okay, let's dive into the treatments. We'll start with the current benchmark. For years, the main approach was pretty broad. Just suppress the entire immune system, usually with super high doses of corticosteroids. But man, the paradigm has shifted in a huge way. So the core idea here is actually pretty simple, but incredibly powerful. Go after the source of the problem. If you have these rogue B cells that are acting like little factories, churning out the destructive autoantibodies, well, the most logical thing to do is shut down those factories. And that's exactly what we call B-cell depletion. The key player in this strategy is a drug called Rituximab. It's a monoclonal antibody, which means it's an engineered antibody designed to target one specific thing. In this case, it targets a protein called CD20 that sits on the surface of B cells. Rituximab locks onto that CD20 and basically puts a big destroy me sign on that cell for the rest of the immune system to see. It has absolutely revolutionized PV treatment and is now a first-line therapy, not just some last-ditch effort. And the proof is in the data. The numbers are just so compelling. A 2017 study by Jolly and colleagues, a real game changer, published in The Lancet, compared using rituximab first versus the old standard of just high-dose prednisone. The results were night and day. A whopping 89% of patients in the rituximab group went into remission. Then, just to drive the point home, a 2020 study by Chen and his team backed this up big time. They found that an incredible 90% of patients treated with rituximab and prednisone achieved complete remission off therapy by the 24-month mark. That's the dream, right? Getting patients off those long-term steroids and into a lasting remission. That 90% number is truly transformative for a disease that not too long ago could be fatal. So let's move on to the next frontier, which is all about getting more precise. Because while rituximab is amazing, it is kind of a blunt instrument. It takes out most of the B cells, the bad ones, sure, but also the good ones we need. The future is all about precision medicine. And here's the key difference in philosophy. If rituximab is like clearing a whole forest just to get rid of a few bad trees, this new approach, called CAR-T therapy, is like sending in a team of surgeons to remove only those specific problematic trees. It's engineered to go after only the B cells making those anti-desmoglian antibodies, leaving the rest of your healthy immune system alone. A great example of this technology that's in development is called CABA-201. Now, this is seriously advanced stuff. It's a type of cell therapy where they take a patient's own T cells out, genetically engineer them in a lab to recognize the very specific B cells causing all the trouble, and then put them back into the patient. These engineered T cells then become this living medicine, actively hunting down and destroying the root cause of the disease. Okay, full disclosure, it's really important to be precise here. The clinical trial for CABA-201, that's NCT06154252, is actually studying it for other autoimmune diseases like myositis, not Pemphigus vulgaris right now. But that's not the point. The underlying technology, the CAR-T platform, is the real story. If this works, it could totally pave the way for a desmogalin-specific version for PV, which could mean a one-time treatment that leads to a long-term drug-free life for patients. All right, let's look at two more emerging strategies. These are a little different from the cell therapies we just talked about, and they're really focused on two things patients care a lot about: getting better fast and convenience. And we have some really clear signposts showing us where the research is headed. This quote, from a 2025 review by Chris Jaroon and colleagues, points to two key drug classes that are looking super promising: BTK inhibitors and FcRn blockers. So let's break those down. So what if, instead of just stopping the factories from making more bad antibodies, you could just quickly get rid of the ones that are already circulating in the bloodstream, causing damage right now? Well, that's the whole idea behind this third strategy. The mechanism here is so cool and elegant. Our bodies have this natural recycling system. It's called the neonatal FcR receptor, or FcRn, and its job is to grab onto antibodies and extend their lifespan. What FcRn blockers do is they essentially jam up that recycling system. By blocking the receptor, they stop it from saving the harmful autoantibodies. So instead of being recycled, those bad antibodies get sent to the garbage disposal. The result? A super fast, dramatic drop in the levels of the antibodies that are causing the disease. And that brings us to our final strategy, which tackles a huge factor in a patient's quality of life. The current gold standard, Rituximab, requires IV infusions at a clinic. The next big leap forward is to move treatment from that infusion center right into the patient's home with a simple pill. And that is exactly where Bruton's tyrosine kinase, let's just call them BTK, inhibitors come in. BTK is a key enzyme inside B cells, and it's essential for getting them activated and keeping them alive. So by blocking BTK with an oral pill, you can just calm down that whole B cell response and cut down on autoantibody production. This gives patients a powerful, steroid-sparing option that they can just take at home. It's a game changer for convenience. Okay, so let's pull all four of these incredible strategies together. When you look at them side by side, you can really see how they build on each other to create this whole new ladder of options for treating Pemphigus vulgaris. This table really says it all, doesn't it? It shows this amazing evolution that's happening right now. We've gone from broad suppression to the current gold standard, B-cell depletion with rituximab, and now we're looking at a future that's even more sophisticated. We've got selective targeting with CAR-T for a potential cure, rapid antibody clearance with FcRn blockers for getting things under control fast, and convenient oral options with BTK inhibitors for long-term, easy management. Wow, we have covered a ton of ground today. And if you want to keep building your diagnostic skills and doing deep dives into conditions just like this, things you'll definitely see in your practice, the Master Oral Patho YouTube channel is a fantastic resource for more detailed explainers. And that leaves us with one last kind of mind-blowing thought. We are stepping into an era where we can do more than just suppress the immune system. We can actually precisely edit and re-educate it. So as we get this incredible ability to surgically target the very cells that cause a disease like Pemphigus vulgaris, what's next? What other conditions that we've always considered chronic might be on the verge of becoming curable?